Let's begin with the first section of our lecture, Chagas disease. And in this section, we will talk about mainly the American trypanosomiasis. And in this one, we will talk about the American trypanosomiasis. We will also talk about the difference between acute and chronic infection caused by the American trypanosomiasis or Trypanosoma cruzi. So we will discuss what is trypanosomiasis, very important. Then what's the difference between acute and chronic infection caused by the American trypanosomiasis, and also we will talk about the natural clinical course of American trypanosomiasis, and then epidemiology and pathology of American trypanosomiasis. So first, what is trypanosomiasis? ACEs, as I always mention whenever I talk about some infectious disease, it's the condition caused by Trypanosoma, which is a protozoan infection. So trypanosomiasis or trypanosomosis, both terms can be used, is the name of several diseases in vertebrates caused by parasitic protozoan trypanosomes of the genus Trypanosoma. So it's a disease caused by the protozoan Trypanosome of the genus Trypanosoma. So that's why the term trypanosomiasis and trypanosomosis, both terms are used because it is the protozoan Trypanosome and the genus is Trypanosoma. So it's a disease that it's a protozoan that causes several diseases in the vertebrates. We have also African, besides American trypanosoma, we have African trypanosomiasis also, and then we have the Chagas disease, which is the American trypanosomiasis caused by Trypanosoma cruzi. So depending on the epidemiology or the area which is covered by the Trypanosoma, we divide it into African trypanosomiasis and the American trypanosomiasis. Chagas disease is a zoonosis caused by the protozoan parasite Trypanosoma cruzi. So zoonotic disease, zoonosis caused by protozoan parasite Trypanosoma cruzi, which is an American Trypanosoma, which is causing the Chagas disease. We have acute Chagas disease. And in acute, we already know acute is the short-term duration disease which lasts for smaller time, short duration. So we have acute Chagas disease in which we have mild febrile illness, mild fever. Result from initial infection with organism. So it results from initial infection with the organism Trypanosoma cruzi. Chronic Chagas disease. So if it stays for the long time, it leads to chronic Chagas disease, and it's a severe form of disease, and it involves the heart mainly. So here you can see this is the diagram showing the heart and how it damaged the heart muscles and it caused involvement of the heart. So chronic Chagas disease is after acute illness. So after the period of acute Chagas disease which present with mild febrile illness. Then we have a period which is indeterminate phase of chronic disease. So after the acute illness, there is a phase that is not very determined, and it's indeterminate period, and it's called the indeterminate phase of chronic disease, characterized by subpatent parasitemia. So in this we have parasitemia, or the spread of the parasite to the bloodstream. Emia is for the blood, so there is a subpatent parasitemia and the spread of the parasite to the blood. Easily detectable immunoglobulin G antibodies to Trypanosoma cruzi. So we have easily detectable in this phase IgG antibodies to Trypanosoma cruzi in this phase. Absence of associated signs and symptoms. So there is absence of associated signs and symptoms in this phase. So after the acute febrile illness, we have indeterminate period. After that, we have in this there is subpatent parasitemia, and then we have easily detectable IgG, immunoglobulin G against Trypanosoma cruzi in this phase, and then there is absence of signs and symptoms. So these are some characteristics of chronic disease, chronic Chagas disease. IgG antibodies are detectable, no significant signs and symptoms present. Now, the natural course of American trypanosomiasis. What's the natural course of American trypanosomiasis? We have acute phase, and then we have chronic Chagas disease, as I already mentioned, acute phase and the chronic phase. Here, the incubation period from the entrance of the organism to the development of the symptom, incubation period is about 5 to 10 days. That's the acute Chagas disease. And then there is patent parasitemia in this phase. Here you can see there is rise in around at the 10th day, 5 to 10 days, slowly comes back by about 8 weeks. After this 8 weeks, there is a period which is the indeterminate period, and then there is subpatent parasitemia in this phase, and that's the chronic Chagas disease. Chronic Chagas disease, if you see, it lasts for about 5 to 40 years if it leads to chronic phase. And there is, in this phase, there is IgG immunoglobulin against the Trypanosoma cruzi. So that's just the diagrammatic presentation of what we mentioned in the previous slide, that there is in acute phase, there is chronic phase. The acute phase is incubation period is 5 to 10 days. At 10 days it rises, then slowly it comes back at about 8 weeks. After that there is a phase which is indeterminate phase, and then once the chronic Chagas disease occur, then it is lasts for about 5 to 40 years. Some of the features of the trypanosomiasis or Chagas disease, there is fever, malaise, anorexia, loss of appetite, there is edema, swelling, rash, myocarditis, meningoencephalitis. Once in the chronic phase, these are some serious implications of the chronic Chagas disease. It involves the heart muscle. There is meningoencephalitis, dysrhythmia, cardiomyopathy, stroke, megaesophagus and megacolon. So it's all these are the severe implications that can occur with the chronic Chagas disease. Already know that acute Chagas disease is there is acute febrile illness, but the chronic disease, we have all these cardiomyopathy, dysrhythmia, megaesophagus, megacolon, enlargement of esophagus and enlargement of the colon, and then we have stroke, inflammation of the heart muscle, myocarditis, and meningoencephalitis. So all these are the clinical presentations of American trypanosomiasis or the Chagas disease. Epidemiology, how the common Chagas disease is, it affects about 6 to 8 million people. So it's a common, most of whom do not know they are infected, because we already mentioned the acute phase is not a very serious phase. There is just mild febrile illness. So they don't know they have illness. At the same time, parasitemia occurs. Slowly it can progress to chronic phase, and that is the phase when the patient will have most serious implications. Modes of transmission of the infection is through contaminated food, kissing bug vector, mother to child, organ transplant, blood transfusion. So all these are different ways by which the Chagas disease can occur, or the mode of transmission is present. So we have food contamination, blood transfusion, kissing bug vector is the kissing bug, and then mother to child. All these are the modes of transmission of the Chagas disease. 100% rate is curable in the early stages. In the 20th century, Chagas disease has caused more deaths and illness than malaria and all other tropical diseases combined. So this is the very, very common in the 20th century. It's causing most of the infectious diseases and the death caused by infectious diseases than any other in illness, because we already saw in the chronic phase it can cause myocarditis, meningoencephalitis. Then we have some other features, megacolon, megaesophagus, and all these can be serious, have serious outcome and poor prognosis. So it's a deadly illness. Now the life cycle and transmission. Life cycle of the Chagas disease or American trypanosomiasis. We have human cycle, and then we have the bug cycle in this transmission. So first of all, what happens is the triatomine bug stage. Triatomine bug, what happens, takes a blood meal. They feed on the humans, take the blood meal, and then in this phase, metacyclic trypomastigote in the feces. Trypomastigote then entered the bite wound or mucosal membrane such as the conjunctiva. So after the blood meal, they entered the trypomastigote in the bite wound, and then what happened, the metacyclic trypomastigote penetrate the various cells at the bite wound side, and in these cells, after they enter the cell, what happens? The trypomastigote transform into amastigotes. So trypomastigotes transform in the amastigote form inside the cells of the person which have bitten or have a bite wound. Then amastigotes multiply by binary fission in cells of infected tissue. So they keep multiplying in the infected cells, the amastigote. Intracellular, now inside the cell, amastigote transform into trypomastigotes, then burst out of the cell and enter the bloodstream. And then these trypomastigotes, they enter the other cells, the same cycle occurs and they keep on infecting the different cells and multiply. So first thing, the triatomine bug, it bites the human and takes the blood meal. They inject the trypomastigotes in the humans. In the infected cells, now the trypomastigotes, they transform into amastigotes. Amastigotes multiply by binary fission, again form trypomastigote, and they again, the cycle keeps on repeating. Now, here the triatomine bug takes a blood meal, so it can infect the other cells, and at this stage also trypomastigote, the triatomine bug takes the blood meal, and again they ingest the trypomastigote in the blood. Again they have epimastigotes in the midgut form, multiply in the midgut, and then again metacyclic trypomastigote form, and they are again, cycle is repeated. So it's the cycle between the triatomine bug and the humans. Once they inject or bite the human, they give the trypomastigote, and then it goes in the cycle, cause infection of the different cells, rupture, and the cycle goes on. So the life cycle of the American Trypanosoma is between the human and the triatomine bug. Now, what's the pathology, or what are some abnormal changes present? The pathology is initial infection occurs at the site of the entry of the parasite. Local histologic changes. Presence of parasite within the leukocytes. So we already know there is parasitemia occurs. With the parasitemia, you can see the parasites present in the white blood cells or the leukocytes. That's the histological appearance. And also in the subcutaneous tissue, fatty tissue, subcutaneous tissue. The skin has three layers. We have epidermis, dermis, and subcutaneous, which is the third layer of the skin, and it's the fatty layer. So once it enters, it also present in the cells of the subcutaneous tissue. Development of interstitial edema. Edema between these cells is present. As a result, you can see in the histological picture, there is lymphocytic infiltration also. And last is the reactive hyperplasia of adjacent lymph nodes. So with interstitial edema and lymphocytic infiltration, what happens, there is also hyperplasia of the lymph nodes, and this hyperplasia can lead to enlargement of the lymph nodes also. Next we have also there is dissemination of organisms through lymphatics and bloodstream. So dissemination of organism occurs through lymphatic system because it's already in the lymphatics and the lymph nodes, and parasitemia is also present. So from these sites it spread to the different parts of the body. So dissemination occurs through bloodstream and the lymphatics. Primarily muscles, ganglion cells heavily parasitized. So all these muscles and the ganglion cells, they are parasitized through the lymphatic and the blood. Heart is the most affected organism, and then what are some pathological changes that can occur in the heart? We have a thinning of the ventricular walls. Thinning of the wall of the ventricles occur. There is biventricular enlargement. Both ventricles become enlarged, and that enlargement also causes thinning of the wall of the ventricles. Apical aneurysm. Aneurysm is the dilatation is present. Mural thrombi. Widespread lymphocytic infiltration. Diffuse interstitial fibrosis, atrophy of myocardial cells, conduction system abnormalities like right branch conduction abnormalities, and left anterior branch of bundle of His conduction abnormalities. So all these changes occur in the heart. Heart is very commonly most affected organ, and it causes serious damage to the heart. Conventional histologic methods, more sensitive technique of detection parasites in the body. So conventional histologic methods. Immunohistochemistry and polymerase chain reaction is also used for diagnosis. Chronic Chagas disease of gastrointestinal tract, also known as mega disease. In the beginning, I mentioned it caused mega esophagus and mega colon. So it's called mega disease, enlargement disease. That's the grade 1. Initially not as bad. Slowly it progresses and becomes severe, and more enlargement occurs. Esophagus and colon varying degrees of dilation occurs. Number of neurons and myenteric plexus reduce. Microscopic examination shows focal inflammatory lesions and lymphocytic infiltration. So that concludes our section 1 of Chagas disease. Thank you for watching sqadia.com.